So we're just going to jump right in. I'm excited to be here today alongside three incredible leaders who've made a significant impact in public health, whether through research, policy, advocacy, or leadership. So public health advocacy and leadership has never been more important, from navigating global health crises to shaping policies that affect millions. Those working in the field are at the forefront of change. But how do you carve out meaningful career in this space? What is it like to transition into a leadership position? And how can you use your expertise to influence policy and drive real impact? So that's what we're here to explore. So over the next hour, we'll discuss career paths, leadership strategies, advocacies, and very practical job search advice. And we've shaped this conversation around what you want to know the most. So many of you who signed up, you provided questions, and that is what has shaped today's conversation. We may not be able to get into every question, but I'll also be keeping an eye out on the chat for audience questions throughout. So if something resonates with you, drop your thoughts in the chat. And if you'd like to continue the conversation and connect with our panelists on LinkedIn after the session, you can do that too. They've said that they're completely okay with that. Don't worry, we will send you notes on the session afterwards. So you can keep your notes, but we'll also send you detailed notes. So with that, let's get started. Let me quickly introduce our panelists for today. We have Dr. Oscar Allen, who is an independent consultant at EpiDoc Associates, who is also the former managing director of the Public Health Division at MITRE Health FFRDC, working on federal public-private health initiatives. And I'll let Dr. Oscar Allen tell me how to pronounce. I've always said MITRE in the back of my head. Also a former chief of program and services at Nature, leading advocacy and policy work for 3,000 plus US local health departments. Dr. Allen has extensive leadership experience in epidemiology, policy, and local to global public health strategy, and currently serves on the Defense Health Board, advising the US Secretary of Defense. Dr. Rachel Mitrovic is the director, the Global Vaccines Policy Strategy and Partnerships at Merck, I believe, in Boston, and leads pediatric and hepatitis vaccine policy strategy to expand global immunization programs. Rachel has worked with governments, multilateral organizations, and academia to drive vaccine access and policy. And she holds a DrPH from Boston University and graduate training in global health, tropical medicine, and health emergencies from Hopkins. And then we have with us Dr. Brandon Wilson, who is the co-interim president and CEO, Community Catalyst. And he leads national advocacy efforts to center racial and health equity in US healthcare systems. He's the former policy leader at CMS and NIH, pioneering health equity initiatives, faculty at USC Chapel Hill's Gilling School of Public Health, Global Public Health, and his research focuses on decolonizing global health and advancing patient-centered community care models. So a big round of welcome to all of our panelists, attendees. We can do a little round of claps in the chat to show we're all here and alive. Okay, so let's get started with questions. Dr. Mitrovic, your career has spanned academia, government, and the private sector. What was that defining moment that set you on your current path at Merck from the time that you were a doctoral student at Hopkins?
Thank you, Roshni. It's a great question. I actually did my MPH in global health at GW during, which now seems interesting to mention, but during H1N1, which at the time seems like a massive pandemic that required global direction. And at that time, I was doing my graduate practicum placement at the Pan American Health Organization in the Family and Child Unit. And we were working directly with how to procure vaccines for low and middle income countries in Latin America, where the disease actually was originating and spreading from. And it was really my first time. I knew I'd always wanted to go into global health. I was thinking neglected tropical diseases in the beginning, but it's really the first time that I looked at maternal and child health services as a whole and really became interested in the vaccine preventable disease landscape and the impact that you could have within that arena, knowing that vaccination is one of the top leading public health strategies that we have at our disposal. So I would really say that was the first time where I knew I wanted to go into global health, but my technical area of expertise became more a focus and really launched my career into having a focus on vaccine preventable diseases.
Did you know that you were going to end up in this space when you were a student?
I did not. I knew that I imagined that I would be working in a lower middle income country somewhere in the field for a while. That was really the goal that I had. Had I predicted that I would have ended in the private sector after the trajectory of my career, I would probably say no. It was a pivot I wasn't expecting, but one that has also been very beneficial in the ability to bring a strong public health background and policy and practice experience at many different levels into the private sector to ensure that varied voice is at the table internally. So I always say that going through school in a doctoral program was a bit like playing darts with a blindfold. You make the best decisions you can at the time, knowing you want to move in a certain direction. And then it's just seeing how those different pieces fall into place, how you weave your story, then how you continue to grow over the path of your different experiences.
Yeah. We're a life design office. We always factor in different aspects of our life and not just linear career path. So right on point there. Dr. Wilson, you've worked in the government and nonprofit leadership. What was your first job after your doctorate, and how did you navigate into executive leadership?
Yeah, thank you for the question. My first job, my first job after doctorate was in CMS Office of Minority Health. Was helping the administration implement some of its health equity priorities, given some of the executive orders that have come out. And actually, it was some of the failings or challenges that I was screaming about in government. Like, if we're creating these innovation models, we have to center the people who are actually experiencing the challenges and harms in model development. And I would scream about health equity before it was a term, and people would frankly get up and walk out the room. And I was not seeking a position externally, but someone reached out to me about this Center for Community Engagement in Health Innovation that seemed really interesting. And it's everything that I was screaming about on the inside, maybe I can do it better from the outside. Not looking for a position. So I figured what I encourage everyone to do is to interview the organization that claimed to be on a journey towards race equity. So I wanted to have my own social test to see how committed they were. Made sure that I was in a hoodie. I had my hair in gangster braids and everything else to see if just talking the talk, but also walking the walk, see if you was also for all kind of Black folks, or just Black folks who have a certain vernacular. So I take it they passed the vibe test because I'm still there. And I would say that life has a way, and I appreciate that you said that you all do not promote a linear model, because I believe in wisdom of words from folks in my family and ancestry. Keep living, and life usually throws something at you, make it a little more dynamic and complex. So I say life also has a way of calling you to things. So I wouldn't say I sought out a leadership position as much as I've always sought impact. And in seeking impact, I think that the position opened up for me to do.
Wow. Yeah, that's a very powerful statement. Look for impact. And you naturally fell into that leadership position as a result of doing that. Dr. Allen, having worked across local, national, global public health, when you look back, what skill do you wish you had developed earlier in your career? And we can talk a little bit more about skills, because a lot of the attendees were asking, how do I even recognize what I'm building during my PhD or DrPH work?
It's something that I actually have told several schools of public health and the Association of Schools of Public Health and Public Health Programs. One of the things you need to really think about when developing skills for students in our field is sometimes the elements that we never talk about, specifically the art of negotiations, the ability to both communicate effectively and understand not just public health communication, but dealing with these types of very elements around the skills and arts of how to negotiate, whether it be contracts, whether it be policy, whether it be intervention strategies. Those are things, skill sets that are going to be vital. The other is one that I would say that I truly believe, there's three things. The second one would be definitely from a student standpoint, get in project management training. We can teach people to be the heck of epidemiologists, but as you move through leadership and supervisory and that kind of elemental leadership within organizational structure, the ability to manage yourself more than just a disease, more than just a program, those things are going to be very instrumental in both your ability to be successful and to essentially understand how the requisite needs of leadership sometimes surpass the simple content or the content management that we have. And the third, if one lesson that I learned the hard way was that oftentimes public health decisions, as we're seeing now, are not made by public health professionals. Understanding that and learning that and figuring out, going back to the art of negotiation, the art of communication, and all of the management elements, how to effectively deal with individuals and interact environments that you will oftentimes find individuals that are not as knowledgeable as you are within this field, but have some degree of quote unquote authority to make decisions. So those are the three things that I would probably hit on for the perspective of that question.
Beautiful. We're only 10 minutes in and we've already gotten a lot of nuggets and wisdom. I put in the chat box. If you have any questions, drop it in the chat. I have one eye on the chat box, but we'll keep going. To all the panelists, you talked a lot about learning to hone your skills in negotiation, communication in general, going where the impact is, being open-minded to what life might throw your way. A lot of times the advice that we give and others give our students is find a way to build your connections, network. So for early career professionals who are blending both remote and in-person work, what's your top tip for building a mentorship network, relationships, and to create that sort of visibility that comes with stepping into leadership? And I think we can start, Rachel, with you if you have any tips on that, and then I'll go around the room.
Sure. There is one really wonderful thing that comes with being a doctoral student, and that is that everybody is willing to speak to you. And I really used the opportunity when I started my doctoral program to say, here's pie in the sky of where I want to go. Thus, I did my own little, before I knew I was doing stakeholder mapping, then I said, who are really the people that I know that have connections there? Who would be an influential person to speak with? And I really use the opportunity, because I wouldn't say by nature I'm comfortable reaching out to people I don't know, to really say, I'm in a doctoral program. I'm very much interested in learning about your career or this research topic area. Would you be willing to speak to me? And to be honest, I never had anybody say no. And a lot of those connections that I made just by being inquisitive and really following their careers, as well as finding in alignments with projects I would be working on in the future, is something that definitely has proven to be successful for building that network. And I think coming out of COVID in this hybrid environment, we've been able to capitalize on being able to make connections beyond our immediate settings. So I would say that is a really important thing. I also think, as we've already talked about, are you a good communicator? And also, how do you understand the drivers of the individuals that you're talking to and their interests? And then making sure that you're entering the conversation in a way that's meaningful for them, as well as meaningful for you. And then I do little things like I still send Christmas cards to people that wrote letters of recommendations when I applied for doctoral programs, or reaching out if I'm at an organization having a meeting with somebody, maybe that was a professor in a prior experience. So it's really, once you cultivate those relationships, continuing to have touch points and continuing to build on them, because some of my best relationships are people that I interviewed with for jobs I didn't get, but I ended up staying in touch with them and so forth. So as we said, nothing's linear. So really cast a wide net when you think about your networking and stakeholder, because as a doctoral student, you're bringing a lot of value to the table and people will definitely be willing to engage with you.
Yeah. Thank you for sharing. Oscar, anything additional to add there?
Sure. So I'm going to sound like, and it's not an effort to advertise for anyone, but I will tell you when and I'm going to date myself because I'm probably the most senior with respect to starting my career path in public health. When I was the student president of my school association at my school of public health, I walked into my dean's office and I said, we want to go to this major conference and we have 7 students. We need your support. And this was the American Public Health Association at the time. And he basically not only funded us to travel to Indianapolis from New York at the time, but he also even gave us a rental car, and we're like, oh, wow, this is crazy. Now, we got to APHA, and APHA was essentially, we moved from just being a group of 7 students traveling to find out who else we could connect with. And we walked into roughly about 15,000 public health professionals. And I never looked back. I say that because the American Public Health Association has a series of groups and sections, whether it's epidemiology, maternal child health, public health nursing, Asian and Native American, you name it. There are roughly about 25 different groups and also special interest organizations that you can hone and develop your network in, whether it's public health informatics, clinical, chronic disease, you name it, those elements are there. What I also found was that you also had those same associations within your state. So for example, being from New York, I got active in the New York State Public Health Association, and they had a student assembly, which allowed you to not only present papers, but also be on career panels and get that kind of direct interaction. Likewise, an extension of your networks, you have on LinkedIn, there's the Public Health Spot, which is an area to really cultivate anyone who's interested in public health or in mentorship and training. And of course, those who are DrPH students, there's new National Association DrPH, which also tries to help mentor and provide some support for those who are in that particular field of interest to that extent. And underscoring all of that is the ability, whether it's remote or being in person, to leverage those networks, to be active in conferences, to see where those information sharing and those career defining opportunities are, where you get to meet people who essentially will recognize you, see you, welcome you in. I will tell you, and I'll end this, my quick comments. I always remember my first conference that I went to where I met the individuals who were the authors of the same text that we were studying, and they were just so down to earth. So it was one of those things where not fanboying, but really truly seeing how public health is a global community and one that you can leverage if you really look at those networks from that sense of thought.
Beautiful. What you're saying is one has to get out of their comfort zone in some ways to make those connections actively. And Rachel, what you were saying reminded me that these skills that you were mentioning, we build over time. We're not just, you don't really snap your fingers and enter into leadership and then you have those skills. You just practice them and learn them. Dr. Wilson, any additional comment on how to build effective networks?
Yes, huge exclamation point on everything that was said. Like I actually keep a standing appointment on my calendar on Mondays to mentor new career professionals or students, and sometimes through that, students have came on an organization, got internships, or brought them on as full-time staff after that. But the biggest thing I would say, honestly, with networking is to suspend conventional wisdom. And if I can build off of some things that Dr. Rachel was saying as well, when you think of stakeholder map, and that stakeholders are not always those that you align in interest with. And sometimes it makes sense to go and engage with the folks who may be completely oppositional to your advocacy or policy priorities. One, so it's good to the world of power lies around that issue. So that when you have moments as these that feel like a complete threat to public and global health, that no matter who's in power, that we're never completely out of power. So I would say that it's key to build alliances across many different sectors. I think especially as we think, but we're probably in public health 3.0 at this point. But like with that, I think to Dr. Allen's point, Many of those in leadership or positions of decision-making within public health are often folks who are public health trained. And many of the upstream determinants, whether you're talking about social, political, or economic, or even profit-seeking determinants of health, that mean we have sometimes have the right problem, wrong payer. And so with that, if we really do believe, let's say that broadband access is a problem or challenge with health determinants, it's not going to be public health that's going to solve that independently. How do we then partner with folks in the Department of Energy so that they can put needed infrastructure in place? So the point of that is to build alliances that are multi-sector and way beyond public health, so that we can really, I think that's where innovation occurs, when we can really challenge convention. Sorry, by nature's advocate, try to break the rules.
Thank you for sharing. I will take an audience question at this point. Mo asks, I'm interested in your advice for how we as students about to re-enter the public health field should be strategic about how we navigate the current landscape. What steps might we take to reach our long-term goals? I imagine a lot of folks thought about government work, but not sure if that's the best first immediate step now. Long fight ahead, says Mo. Maybe we could start with you. Yep, Dr. Allen.
I would raise my hand because I was actually starting to type an answer to that in the chat. So you pulled it, so I won't. So one of the things I would say, and I always recommend to early career professionals or anyone, students or even individuals who are looking for mentorship and career advice, is to set up a 2-5-10 plan. And the 2-5-10 plan is simply, where do you want to be in 2 years? What is the goal? So in case of this global health stage, do you know which targets you want to meet that goal? Which area in global health? What employer? And what will be needed in order for you to be able to be successful and land in that particular position and avenue? And how will you achieve it, right? Who are the individuals? What are the networking opportunities? What are the skills that are going to be required to make you both competitive and successful in that accomplishment? And then once there, what are those 5-year goals that you plan to, how are you not looking for a rapid progression? You don't join something and expect in 1 month to become the senior director or the senior vice president. But at the same token, what are those milestones and those markers that will be helpful in both strengthening your career resolve and illustrating that degree of accomplishment and really seeking to support your goals in mind? And the 10-year plan. And I know most people, especially early career professionals, are like, I can't think 10 years from now, but there's a reason and a value add for having those, and they can pivot, they can change, but you constantly reassess that. It's not just to say create a vision board, but really use it as an active plan to help gauge what are those elements that you find to be important, what are those impactful strategies, and you can use that as a template to help you guide the path that you seek. In this example, in the global health, whether it's in a governmental strategy, and government has many different meanings. I would say local government gives you things that have an impact that is more global than anything else. Whatever is global happens locally. So think about those things in that element, and really you fashion that 2-5-10 in a way to truly help you accomplish that end. Thank you.
Thank you. Awesome. Mo, I hope you're happy with that answer. We'll move on and move to Dr. Mitrovic. I wanted to ask you, many attendees had shared in their questions prior that they wanted to know how to transition from operational roles like public health analysts, scientists, into strategic leadership. Given that the conversation today is about leadership advocacy roles, what advice do you have for making that leap? Like, how do you end up from those operational roles to a strategic leadership?
That's a great question, actually. And when I think of operational roles, a lot of what that resonates with me is that research, that quantitative and qualitative background, or as Dr. Allen and Dr. Wilson have talked about, the art of negotiation, as well as one I'd add to it is having financial acumen with project management, because those are cross-cutting skills that regardless of what area you're going to enter with your career, they are required from leadership. I think, and I'll put this in the context of my own career because it's something that I've had a focus on, of how do I make the transition from academia or a multilateral into private sector, is being able to translate knowledge and practice and evidence into what is meaningful for leadership or decision makers. And I think that's a very important skill to be able to hone in on. And that is being able to really not only say, this is how we executed, or this is what the research said, but really answering the so. What does that actually mean? What does that mean when we put it into practice? How does that drive policy decisions, or how does that create a counterfactual that we need to think about? So really for me, it's, can you really think strategically beyond where we are trained as public health professionals to see the larger picture, the dependencies, what are the headwinds and the tailwinds, and being able to do that high level strategic thinking, because that's really how you move forward into leadership roles and have a trusted voice at the table, other than being well educated and a technical expert in your area of expertise. So I think for me, it's really knowing who the audience is and being able to apply what you know to meaning to them.
Mm-hmm. Thank you for sharing. Anyone would you like to add to Rachel's point? Dr. Wilson? Okay. Dr. Wilson, I do have a question for you. You've worked in both federal agencies, nonprofits. For career growth, is it better to stay within one organization or move across organizations? How do you make those decisions?
I wouldn't say either is better, but I'm a person who, I think one has to know their own self. Like only you can answer that question for you. For example, I think there's great wisdom around how to plan out one. Frankly, never made one plan for where I'd like to go in a career. I've used this Japanese, which means purpose or meaning for life. And then ask yourself key questions like, what are you good at? What do you love? What does the world need from you? What can you be paying for? And I used to make the mistake in thinking I had to find a position that fit all of those things simultaneously. And that's probably too much for any one position to hold, or for any one space in my life to hold that. Maybe I'm in a space in life to where it's all about what do I love? Maybe 5 years from now, life will bring me to a space where it's more so about what can I get paid for? Because life is dynamic, and maybe throughout the whole of life, I've gotten to experience all of those things. I was in clinical research at NIH, and was working on this trial for a very long time. This HIV clinical trial, multi-site, multinational. And it looked as though that those in the control group were acquiring HIV those who were in the intervention group were acquiring HIV at faster rates than those in the control group. Freaked us out, so we stopped the trial almost immediately. And there was a researcher who I was working for, the name of Dr. Bernie Graham. And he had tons of interest in RSV and COVID. This would never be a thing. Like, why in the hell are you spending all your time on these things that would never make any sense? Frankly, he knew more than I did. But the point to me was, you can spend your whole life on something in clinical research, and you may not see that movement. But that's okay if that's how your brain is wired. I needed more proximal steps in my career to see impact. So I switched over to do policy, but I was able to use some of those same research skills for clinical research in population health studies. And so I would say, even whether it's within academia, within research, within public health, I think that the beauty of it is it's large enough, life is dynamic enough. I actually don't even believe in the concept of one career per se. I think if it's 10 things that you're interested in, you have a whole life, figure out a way to do 10 things. So I won't say that one is better or one's good or bad. I think it's what's worked for you. But I think you have to ask yourself questions, and it's a journey of getting to know yourself.
Thank you. An old friend of mine in the chat was actually repeated what I was thinking in my head, that we're all getting not just career coaching, we're also getting life coaching from you, Dr. Wilson. Brent says, for my own mental health, I need to create an AI model of Dr. Brandon to coach and talk to me all day. So a little bit of light humor that day. But since you were talking about skills and it being such a vast set of skills within the public health community, Yihan has a question here. Have you seen in your experience PhDs in non-public health backgrounds, for instance, Yihan here in literature, step into public health advocacy? And what might that look like? Have you colleagues in that space that are non-public health folks as well?
I'm sorry, who was Rachel?
No, please.
I apologize. So one of the things when I was at MITRE that was helpful, that's fine. And internally I will say Mitre as well. Everyone says Mitre. One of the things that I remember when I came aboard as a manager director of the public health division, I had a series of staff. Many were classical trained in public health and others who were not, whether they were systems engineers or social scientists or others. And they kept saying, what's the longevity and where do I fit into this? And I stopped them dead in their tracks. And I said, let me correct you all in one way, shape of thought. We're all public health. Whatever you do, whether it is in a classically trained model of public health or social science or our tent is so big that everyone is public health. And we want, right? When we think of things as health in all policies, health in all practice, whether, as was mentioned before, non-traditional supports, whether it be in business, finance, you name it, laboratory science or the non-scientific fields, every last one of those have an interest and a stake in what we term as public health. So don't feel that whether your field of interest or your study puts you on the outside. It actually is a great asset to use to implement not only a nonlinear way of thinking, but a big tent opportunity to bring all of these prevalent ideas onto the table so that we can come up with better ideology, better ideas, better solutions, better interventions. All of that enriches our whole process.
Beautifully said. On the same topic, I think I know the answer to this, but this was a repeated question that the audience had asked. Is there a difference between a DrPH and a PhD? What are the biggest career opportunities, and what are the biggest differences?
So I'm happy to start with why I chose to pursue a DrPH, because I definitely spent quite a bit of time researching the differences or the different tracks and where they would take. For me, I think having a DrPH is very interdisciplinary. It is knowing that you need to have hard quantitative skills, you need to have leadership skills, you need to understand the project management financing. So I always looked at it as a generalist. But for me, it was really that opportunity to put policy into practice or drive evidence-based decision-making. So for me, it was an easier decision because as I thought about the type of career that I wanted to have, going back to Dr. Allen's 2, 5, and 10-year plan of knowing that I also guest lecture quite a bit and really enjoy that teaching component, but I really wanted to be in the field, driving that change and having a leading voice. And I felt that a DrPH would equip me. But with that being said, I know many people within the DrPH network, and I know many people within the PhD network, and getting one degree over the other does not limit your career trajectory in any way. As we've talked about here, you need a broad background, and the more voices and the more experience, the better. So it's just figuring out if you do a PhD route and you want to be in this end role, how do you play to those strengths, and then what skills you continue to build on over the career experience or the jobs you may have as you're working towards your 10-year goal.
Thank you. Everyone's spoken a little bit about skills, and project management's important, communication's important, learning to have that financial acumen at the leadership stage is important as well. Kimberly wants to know, how do you best communicate these skills, especially if someone hasn't had direct experience in their studies right now with project management or advocacy? Or if you come from a non-traditional background, how do you communicate those skills? And I'm assuming that question is during job interviews to employers in your job application materials. Any tips and tricks that you might share on effective way of translating your PhD or DrPH work into transferable skills that might make it attractive to employers? Dr. Wilson?
Yeah, so number one, no one knows you better than you. And so you put me in a room and ask me to talk about me, I'm probably going to talk too long. So number two, I think is being able to, of course, do your research, of course, know the position. The beautiful thing is, you all have like access to information and technology like no one other generation before. AI is probably a wonderful tool that can help you figure out how to transfer and then speak about those specific skills that you have to align with something that you're trying to grow into. That said, I will say that every position that's put out, every job description, it's a wish list. And really, you probably do not want to accept a position that you 100% fit everything on there. If you think that you're excellent at everything there, there's no room for you to grow. So maybe 80% and then 20% is something that you can actually grow into. I think it's having foresight. For example, I think in advocacy spaces, I think forever we've leaned into almost 100% into the need to have great communication skills, to have good public speaking, good advocacy skills, even some good research sometimes. I think the landscape of healthcare is changing so much, and probably now, but certainly in 5 years from now, the skills that we're going to need are completely different. I think we are going to need people who have very strong business skills, or who can look at a profit loss statement of any corporation per se and follow the money. We can actually look to see if your values actually align with what your mission statement is. So I think we're going to have to really need some like really grunt technical financial research skills to help us really connect the dots in ways that we have not before. So all that to say, if you are a systems engineer, as Dr. Allen mentioned, I would say if you're a vaccinologist, no matter what it is, I think you have a role to play. And it's you knowing yourself and also having some foresight of where things are going and how you can be a critical element to solving that problem. Last thing I'd say there, hopefully I'm at least somewhat answering the question here.
Yes.
No one's gonna, especially if you're looking for like big money and opportunities, no one's gonna really pay you to come in and do. We have processes for that. We have systems for that. And now we're creating applications and robots and everything else to do that. The value add you'll have is to be able to come into a very gray, messy, disgusting scenario and world and be able to make sense and bring some order to the noise and the chaos. So think, given your unique perspective and where nobody can do you like you, I personally think that you have more strengths to bring to the table, because clearly if the table had all the voices there, the problem would be solved.
Beautiful. Nice way of ending that piece. And I think we're going to segue into career paths. There was a lot of questions around your own personal career paths. Dr. Allen, folks wanted to know what led you to independent consulting and what should someone know before making that jump?
Thanks for that question. I think it's an interesting one because oftentimes we are caught in a realm of where do we fit in and what is the right career path for us. And I would actually describe myself as governmental public health, or thinking of today's, I should say, our more recent environmental change, a recovering epidemiologist, just in the sense that when you think about where your path is and what your goal in life and how you plan to accomplish things, where you put your full effort, can truly find unique and innovative ways of expression. So being in governmental public health, and I think going to the message of the question that asked about independent consultant, the key goal in all of that, the underlying pillar, is that of having a position of being a trusted advisor, a trusted partner. Public health is a team sport. And as I mentioned, we take everyone from all over. So the ability to not only look at data sharing, best practices, the scientific process, the communication angles, and all of the other logistical intricacies we speak about, being able to develop one's competence and one's ability to be an entrepreneur, or even specifically work in consultancies, being that support mechanism, being part of that team, those are elements that folks should really not feel too skittish about jumping into. And I know it's somewhat, and speaking to colleagues in this space, sometimes people feel like, are we selling out? Are we chasing a big buck? Or are we not staying true to the goals and aims? In reality, as was just mentioned by Dr. Wilson, we do have to know how to operate businesses. We do need to know how to run programs, how to run intervention strategies. We can't just operate solely on the programmatic effort, because even the programs themselves need that opportunity, that ability to understand evaluation and what that costs. What does the time and effort, how much is your skills going to illustrate on I won't say profit and loss margin, but shown on paper the amount of effort that will be taken in from what you provide into the outcome. And having that, I would say, does really help build those individuals who are in a spirit of entrepreneurship, who are able to leverage their networks, who are able to both operate in that space that keeps them both true to the cause and at the same token, financially independent at the same time of ensuring that they help drive the path that they see best for their career trajectory.
Thank you. Thank you for sharing that. Dr. Mitrovic, can you tell us a little bit about a day in the life of someone who works at Merck? Can you walk us through? I heard you say earlier you're remote as well, and you have that flexibility at Merck. Can you tell us a little bit about what is the essence of your job?
Yes, that's a great question. I do work remote, but I sit on a global team, and I am the strategic lead for our pediatric vaccines portfolio. And I also manage what we call our above brand portfolio, which is health systems level work that we're doing to ensure that immunization programs are strong enough to deliver. So I was brought into the role to serve more as a think tank and build a team that could really roll our sleeves up, do intense policy analysis. And then probably what I've had to work on the most over my career is how do I translate that into business impact? So I usually start my day quite early, between 6:30 and 7, because I'm talking to Europe or Asia and sometimes finish late. So most of the people that I speak with actually are not sitting at headquarters in either New Jersey or Philadelphia, because we utilize a global, regional, local level model. So we have employees across the world. But I would say just one illustrative example, and probably something that happened last year that was very fulfilling to me, because as we go through the talk, I think the one thing we haven't mentioned, but is inherent, I believe, if you pursue a doctoral program, is passion. So I gather that we all have deep passion for what it is that we do, and making sure that's an underlying current. But I worked on a 2-year project with the Ministry of Health in Jordan, and they have a large refugee population, and they've been trying to figure out, to link this back to funding and P&Ls, how can they afford to provide the same immunization services to the refugee populations as to the nationals in country. So as a pharmaceutical company, and looking at this from a health systems level, it was not associated to sales or profit. But we worked with a financing expert to landscape where the funds were going in the Ministry of Health, where they were flowing through the government, where there were expenditures that either were lost, so money not being spent, or money that could be utilized. And we spent a week with the Ministry of Health and the Ministry of Finance presenting our research, giving them a suite of options that they could pursue, and really buy that ownership from them. And then over the second year of the project, it was holding advocacy events and bringing in other voices to own the process and to really be varied voices. And we found out towards the end of last year that the Ministry of Health had appointed a special task force to look at this, and that they were going to be implementing an additional tax on tobacco, which in a country like Jordan is very impactful, because the tobacco lobbyist is very high. I think the first age of smoking for males is 6 years old, and how they were going to direct the sin taxes from tobacco to their prevention program to make sure that refugees were being offered the whole portfolio of childhood vaccines. So it's a unique role within a pharmaceutical company, but within policy is doing a lot of landscaping, understanding what the problem is, doing that work ahead for different stakeholders. And then once you have done the landscaping, handing that over to the right stakeholders to take ownership to increase the varied voices and then drive impact.
Awesome. Thank you so much for sharing. You painted a beautiful picture of what it's like to work in your role. Shifting gears a little bit, I will come back to you for a lightning round to all of you, but I did want to ask Dr. Wilson, nonprofits and community-based organizations obviously play a major role in public health. What are some of the biggest misconceptions about working in the space? And then how do you position yourself for those roles straight out of academia?
Yeah, I think that probably I answered in reverse order. I think probably the easiest way to get involved, like in nonprofit or certainly advocacy work, is demonstrating impact. That's really like that's the driving mission. That's the vision. That's the purpose of why we exist. And there's always a way to plug in. Listen, at the end of the day, when I tell staff this all the time, to be a paid advocate is actually a privilege. There's a mother somewhere who's trying to take care of an aging parent, a child with a disability, working on a part-time job, if that, who gets very minimal wages, no health coverage, do not get paid time off or paid sick leave, and they're finding a way to still advocate because their very lives depend on it. Dr. Rachel just mentioned that the word passion. I think that's where passion comes in at, where passion connects you to that work. Some of the misconceptions, and thinking misconceptions do come from conceptions or some form of generalization, so there may be some truth or element of it, is one that you will get paid less. That is not necessarily the truth. There is a misconception that nonprofits are more risky than, let's say, working in government. We're seeing this week that may not be completely true. Other one I would say is a misconception that you can't use, let's say, your research skills in there. That's not true. I use research in my work every single day. And actually, in mixed methods research, I use qualitative and quantitative. That said, where I'm going to push a little bit then is always challenging conventional wisdom. Like when we talk about research, I think then we have to ask a couple of questions. Are we doing this work on communities, for community, or with community? So to make sure that we're not exploitive in our research pursuits. Lastly, I would say when we talk about things such as validity and reliability, right? Who gets to establish what's considered valid? Did Ivory Towers establish that? Did that include community voice and community perspective in that? Is this something that's really replicable? Did we really validate this from a multicultural perspective? I'll give an example of why that's important and some research that we actually did in the advocacy space. NIH put out an instrument, patient-reported outcome measurement information system, to help us better measure health-related quality of life. When trying to validate the instrument with Black, same gender loving men living with HIV in this country, it could not be validated. It had to add another scale, particularly around stigma to it. Had the instrument been used as is, it would have misdetected that and resources would have been allocated according to what it was detecting. One item on it, and I'll quickly shut up, was like looking at pain, severity, and exhaustion. Get asked the question, if you go out and cut your grass, how tired do you get afterwards? You're assuming I have a yard. And on the most privileged end of that, you're assuming I'm the one who's cutting my yard. I'm probably not. So had that question been validated in different communities, it probably would not have existed. All that to say, I think there is a place for some of those skills in advocacy and in nonprofits. But along the way, I think we get to innovate not just programmatically, not just policy-wise, but we get to also innovate methodologically. Last thing, quickly, I would say that my original background is theology. there's a scriptural reference that say that you cannot put old wine into new wineskins or the whole damn thing bursts. And I think that's what happens sometimes. We're trying to innovate programmatic and policy-wise and using the same evaluation methods.
Mm. Thank you. There's been a lot of ahas and what you're saying. So thank you so much. I do want to get to this question before we come to the end of our time together. What key opportunities to the best of your knowledge exists for international scholars to make a career in public health leadership and advocacy, whether in the United States or outside? And anyone can go. It's a rapid fire round.
So the term advocacy is one of significant interest because depending on where you sit on which element, you may have a different definition for it. And when we speak about advocacy, we're not speaking about lobbying, but we are going back to negotiation, the art of persuasion, right? We want to make sure that folks truly understand the aims, goals, and the structures and the solutions that are very firmly based in a public health principle, whether it's a health and all approach or not, but to ensure that those interest holders are understanding of the rules and understanding of the outcomes and the value add to be on that side, to basically be proponents, to extend our reach, right? We know in our public health demographics, we're small in numbers, but ultimately the reach is what really brings that quote unquote power to extend. So it is incumbent on individuals to learn the systems that are within their reach, whether they're an international landscape or not, maybe ministries of health, it may be ministries of I don't want to say healthcare, but just in general, social service, human service needs, and understanding how those policies, laws, and extent have an impact on the work that you're trying to both be impressive on as well as be a leader within. Having that knowledge and understanding how to navigate that, whether it is in a local perspective of being active in local government or learning how policies, laws, procedures are brought into bear. Those are the things that will help you basically strengthen your foundation in advocacy and also raising those voices. Many of us have talked about, of course, being the voice or being individuals at the table, whether it's the communities that are being worked with and not just for or on, and more specifically, building on that framework that ensures when we're thinking about that feedback mechanism on our 10 essential public health services, that this empowerment is not a one-directional thing. Those are pieces that when you put together on that larger patchwork around health advocacy and leadership in the advocacy space, public health professionals have a great leg up on understanding that. And from an international perspective, you can definitely find those inroads being in a very structured way to support both your sustainability, understanding, and rate of success in hopefully imparting change in behavior.
Thank you so much for sharing. And participants, I just want to take a minute to share that our time together has been very short. I wish we could continue this conversation for another hour. Just appreciate you coming. As we complete today's session, I want to ask one question, lightning round, 10, 15 seconds per person. If attendees in this call and those that couldn't attend today could take one action in the next 3 months to advance their careers in public health leadership, what would it be? Dr. Mitrovic, we'll start with you, go around, and then end our session today.
I'm going to cheat and give two.
Okay.
The first is don't be discouraged by the environment in which we're operating right now. Use it as drive to push you forward and know that you're pursuing a meaningful career that will hold a lot of value. And I think that is just something that it's easy to get lost in the noise right now. And we need to stay focused so we can really drive impact. I think the other thing I would say is think broad as you're thinking about your career. It's not only about, I know there was a question about government roles, but you have multilateral organizations, you have ministries of health or ministry of finance, you have patient organizations, you have private sector, you have foundation. These are voices that are probably going to be able to be amplified a bit more given the current geopolitical landscape. So it's finding how do we elevate the different voices at the table to maybe lead where they haven't led or been in that role before. And I think that's important when you're looking at global advocacy, because a lot of global advocacy, it's not lobbying on the Hill or legislation, it's agenda setting. It's working with OECD or G7 countries to make sure preventative health care is one of the priorities, or we talked about maybe it's technology to drive electronic health systems. So the network is so broad. Just push yourself to think outside of the box as you look at your career moving forward, because it is not constrained in public health. We are able to bring everybody to the table, and different skill sets always are of value. So I think the main thing is don't be discouraged. There's a lot of work to be done and still many platforms to accomplish that on.
Very encouraging and positive note. Dr. Allen and Wilson, any final thoughts?
Doc?
Sure, I would go really quick. If you do not know him, go look up Dr. Vivian Thomas from Johns Hopkins University. Watch the movie Something That the Lord Made. And I would give you a cheat code if you have not. I would say to me the synopsis of the movie is whatever God, universe, parents, your family, whatever that call is for you, the resources in order to actualize that will always be and have always been put within inside of you or within reach of you.
Mm.
And I will add, I'm going to go back to my days as being a public health preparedness person and really speak to these 4 pillars that are, as everyone has just mentioned, help you even further with how you can navigate these current waters. In preparedness, we look at both response, recovery, just thinking about preparedness, response, recovery, resiliency. No matter what we do, no matter what we have coming our way, whether you're looking at it from the lens of a community individual, you're looking at the lens of our public health field, or of our area of expertise, being prepared is important. Understanding those core concepts of what you need to do to be prepared to shifting climates, to being productive in one's career pathway. Understanding that the responses effort is going to be both important. How you choose to respond to a particular set of indicators, impacts, et cetera, will drive the outcomes or will drive a certain set of outcomes. Having that recovery period, right? We're not always going to be winning. So we need to identify what are those spaces that we can allow for us to be impacted and have the most minimal level of that impact to be negative to our livelihood and our well-being. And more importantly, resilience. And having that resiliency is going to be of utmost importance if we're going to be successful in making a change and improving the life and wellness of individuals across the world.